I'm McCaul. I'm a community pharmacist in North Manchester in a little suburb called Prestwich. I'm also chairman of the Independent Pharmacy Federation, the leading organisation for independence. Well, after all the activity of the Olympics last year and Wimbledon this year and the cricket that everybody's doing so well in, we're having a huge influx of young people who are really being active. And the sports injury question is very relevant as it is at the minute. And there's only one way to deal with sports injuries. There's two things you've got to remember: price and harm. And when we say price, we're not talking about the price of the goods. It's a little nomenclature to remember how best to treat patients. Price stands for P, protection. Let's get some protection on that wrist or ankle and make sure it's got well wrapped up. We need to be rested. And we're talking about 48 to 72 hours rest, but only that. Ice, keeping it cool. Not having an ice pack on overnight, but using an ice pack or a freeze spray every 2 to 3 hours. Compression, getting that well protected and getting the anklets on it. And then elevation, when people are sleeping at night, making sure you're taking the compression bandage off, but getting it raised up and rested. And harm is to make sure we do no more harm. It's not about using heat in the first 2 to 3 days. That comes later. It is not about taking alcohol like most of us do. We shouldn't be celebrating that injury. Far from it, we should be staying away from the alcohol. No more exercise. Let's cut back on the running or whatever caused the problem. And finally, no massage yet. Give the area time to heal. The massage can come later. Rest is really important at the start, okay? But we don't want people lying in beds for 3 weeks anymore. Rest is only for 48 to 72 hours. After that, we've got to gently get back into the exercise. We're not running a marathon straight away, where we're taking steps and making sure that the muscles get back that memory. If we rested too much, it's actually more debilitating for the muscle.